market. We actually work together on creating the reinsurance program, those subsidies for the young, checking the box when people do fill out their tax returns. And we have done great work. However, we have healthcare access and affordability remains a challenge for many Marylanders, including undocumented immigrants who are barred from purchasing health insurance through the state health benefit exchange. Basically, we were able to cut the state's uninsured rate by more than half, but we have nearly a third of those who remain uninsured, and they're tax-paying immigrants. And applying for a 1332 waiver is really the right thing to do. So I am in front of you humbly asking you to please submit an amendment for the 1332 waiver. Not seeking this waiver costs our state money. Last year, the hospital spent $150 million in undocumented, in basically providing the most expensive care. People go to the ER for undocumented individuals. The year prior to that, they spent over $300 million. That is 22% of all statewide uncompensated care. And as you know, we're going to get ready to negotiate the waiver, and this is really important. Unfortunately, the Maryland General Assembly was not able to pass the bill, House Bill 588, which would have opened up the exchange for undocumented individuals. It passed the House, it didn't pass the Senate, but that does not mean that we're not committed to do that. We are very committed. And I know that you're able to submit without legislation. Both the Senate President and the Speaker of the House, I have sent them an email requesting letters of support, and I have spoken to the governor, and the governor is very supportive. And we can get you those letters so that you can actually give them, submit them with your application. I humbly ask you to please consider it. The need to extend healthcare options to the uninsured in Maryland is really important. We have had a lot of studies already. The Joint Chairman's report by the Senate Budget and Taxation Committee and House Appropriations Committee that detailed the interest in increasing affordable healthcare options for uninsured Marylanders. Last summer, I requested the Maryland Insurance Administration, and I asked the Ben Steffen and also the exchange to look at what can we do to cover the undocumented individuals. And there was a letter that you provided that this was one of the options. So simply stated and with a lot of humility, I ask that you please submit the waiver and do it as soon as we can. President Biden is doing it for Dreamers. In Maryland, we missed an opportunity. We lead. What a missed opportunity, but I know you can get us there. So thank you so much for the consideration. Thank you for the work you do. I really value and respect our partnership.
Thank you very much, Delegate Pena-Melnick.
Thank you.
Next.
Bonnie Cullison.
She's on mute.
Thank you very much. Thank you, Madam Secretary, members of the board, for this opportunity to speak to you this afternoon and to just echo the passion and concerns that my chair, Pena-Melnick, just expressed to you. But first, I also appreciate the partnership that we've had with the exchange, but I wanted to just call out the work of the exchange over the years. And if you've listened to any floor sessions that I've had the opportunity to speak to bills that are specifically related to the work of the exchange, you will hear me say, you will hear me talk about how well it works, how efficiently it works, how it is absolutely dedicated. The folks who work at the exchange are absolutely dedicated to our goal of 100% coverage of affordable healthcare for all Marylanders. So this is just another step in that direction. We are still 6% of our Maryland residents who are not insured, and we expect that about a third of them are undocumented immigrants. And for them, in many cases, it's because they simply don't have access. And that's what this plan was intended to do, to the request for the waiver to provide access to the plans on the healthcare exchange will go a long way in that 6%, I believe. And I think as much as we, can continue to whittle away at that, it's important. You all have done the actuarial reports, your teams have done it. And you've said that while there might be options, different options to address this issue, this one is clear. And we know that other states are doing it now. So, it's a way forward that has a very clear path. And we believe it's the way that we can move this population into being insured more quickly. You know very well that the resources, the health resources that are available to undocumented immigrants are very limited. And what we saw in this session was people coming to us who were very ill, who had had conditions that were being treated in emergency rooms, but then couldn't be treated when it was no longer urgent. And my contention is they would not have gotten to that place had they had the ability to do preventive care, regular checkups, the way to take care of the problems before they start. So that's why it's so important to give them access. And I want to also echo what Chair Pena-Melnyk said in terms of these are tax-paying residents. These are the people we're speaking to now, that they are working and contributing to our economy, and they are not being able to take advantage of this. There's trend of our exchange. There's tremendous support for this concept. There are over 100 organizations that range from ministries to unions to public advocacy groups. I think it's really important to note that the Maryland Hospital Association is very much in favor of this bill. So they understand how important it is to get everyone insured. Ultimately, it's simply the right thing to do to provide health insurance, affordable health insurance to our Maryland residents. But it's a win-win situation. The families win when they can buy into affordable health care. Our communities win because people can be more economically stable, and therefore our communities can be more economically stable. And the state wins because our public safety nets are not stretched so thinly. So with that, I thank you for the opportunity to speak today and ask you to please do what you can to make the request, amend our waiver to include undocumented immigrants with access to our healthcare exchange. Thank you very much.
Thank you, Delegate Cullison. Thank you both for your time today and for your thoughtful comments. With that, I'll move to the executive update from our fearless leaders, Michelle.
Thank you, Secretary Scott. And thank you all for joining us, whether you're on phone or if you're in person. We appreciate that. So just some federal updates that I'll go through as we did just hear on April 13th, President Biden proposed an expansion of health coverage for Deferred Action for Childhood Arrivals, or DACA, recipients. And that proposal would allow DACA recipients to sign up for health insurance through Medicaid and through the Affordable Care Act through the marketplaces with tax credits, availability for those tax credits. So the process has to be completed through regulation. President Biden wants to fast track this. He talked about the end of this month. Typically, regulation takes a long period of time. So we will follow this closely. And the group of state-based marketplaces, we are all going to be convening in DC on the 24th and 25th of this month. So I'm sure there'll be more discussion, and we will be meeting with both the House and the Senate and the administration. So I'm sure there'll be more discussion about that. Another federal update, the recent Braidwood Management versus Becerra decision by Judge O'Connor of the Federal District Court, Northern District of Texas. You probably all have read about that. And that is was decided that the federal government cannot enforce part of the Affordable Care Act, which is the preventative care. Fortunately, again, thanks to our administrations now and before us and our General Assembly, Maryland has really been ahead of the game on this. And I think both of the delegates that are joining us today actually helped move legislation forward that would ensure preventative care in the state of Maryland is covered on all of the health plans for which people get through the Maryland Health Benefit Exchange, Maryland Health Connection. So we don't have to worry about that, although we are keeping tabs of what is happening nationally, and we'll continue to report on that. At the federal level, the other item ongoing is, again, the significant concern about the Medicaid public health emergency unwinding. Again, in Maryland, we're really fortunate that, one, we have an integrated eligibility system between the QHP and the Medicaid, and two, that we have such strong partnerships between Medicaid Department, Maryland Department of Health, Maryland Department of Human Services, and the exchange. And as I speak to others across the nation, we're in really good shape. You're going to hear more about this at the end of our meeting today from Debbie Rupert, who's the Executive Director for Eligibility at the Maryland Department of Health. Some state updates, just a couple of things that I'll provide. I reported to the board that we met with Secretary Lopez of the Department of Human Services, and they have a big campaign ongoing right now about recovery of stolen EBT benefits. We have been really lucky in that our marketing department under Director Betsy Plunkett has been able to swiftly move that campaign through our social media channels. And so we're running it as well. We'll continue to run it through the campaign. Just everyone who's watching today or about today, if you know anyone or can share this information through any of your channels for folks who may have been the victim of EBT benefits being stolen, please have them go to the Department of Human Services website, where there is now a remedy for them to get reimbursed. And our Tax Time Easy Enrollment program ends tomorrow, which is last day to file your taxes. So if you haven't done that, get busy. And we will be continuing to accept information from the Controller's Office, even through folks that have filed an extension. So all the way through September, if anyone files an extension and does indicate that they would like health coverage, we'll be able to reach out and help them. Next month will be Vice Chair McCann and Board Member Mary Jean Herron's last board meeting. So if you're able to join us in person, please do so we can wish them well and celebrate their achievements. That board meeting will also have a lot of procurements. It's a heavy procurement month in preparation for our new fiscal year that starts July 1st. And then just a couple of staff updates. Our new Director of Compliance and Privacy actually starts this week, April 19th. And Scott Brennan is our new privacy officer. So you'll be meeting him, but more to come on that. And then finally, we MHBE was named Executive Alliance's 2023 Honor Roll. And this honor roll award is given to organizations that have a proven commitment to developing women in leadership roles by having at least 30% of their executive leadership and 30% of their board seats held by women. So we have done that at both our board and at our leadership levels at the agency, and we're pretty proud of that. So I have, Secretary, back to you.
Thank you, Michelle, for that update. I would be remiss if I didn't mention that Michelle and Delegate Pena-Melnick were all on the Daily Records Power List this year. So, so congratulations, speaking to the women leading change in the state. So I'll just give a little applause there. And next we'll move on to Dana Weckesser to give the Board Policy Committee report.
Sure. The Policy Committee met twice since last board meeting on March 6th and March 20th. On the 6th, the board provided staff with feedback on a proposed agenda for the board's June in-person meeting. Actually, I should say the committee members, the policy committee members provided staff with feedback. They also provided feedback on proposed board meeting dates for state fiscal year 2024. As required by the board bylaws, these dates will be presented to the board for discussion and approval at the June board meeting. On March 20th, staff summarized the proposed changes to the board bylaws and confirmed that the committee supported them. The committee has discussed updates to the bylaws over the last several months, and Sharon will be presenting the proposed changes at today's meeting. MHBE legal staff also presented a new proposed regulation to establish procedures to guide the board through conducting an administrative hearing. The policy committee was comfortable with the proposal, and MHBE staff expect to present the proposed regulations to the board at the May meeting. Now, if we could bring up the presentation. MHBE's policy ensures that the Standing Advisory Committee member makeup, to the extent practical, reflects the gender, racial, ethnic, and geographic diversity of the state, and also provides a diverse cross-section of stakeholders pursuant to the Maryland statute, section 31-106G2I. In consultation with MHBE staff, the SAC co-chair, John Frank, and I am the board liaison to the Standing Advisory Committee, recommended 7 applications to join the MHBE SAC, or to the committee, at the February board meeting. The SAC advisory group had highlighted a critical lack of Western Maryland representation of current SAC members, and MHBE staff worked to recruit an additional SAC candidate from Western Maryland to recommend at this board meeting, along with 1 additional applicant that was not presented at the February meeting. Okay, the overview of the whole procedure. Application was posted December 8th, 2022 through February 8th, 2023 for applicants to, potential applicants to apply to the committee. Was consistent with, this process was consistent with the policy and procedure. Staff identified goals for recruiting new members to maintain the committee's reflection of the diversity of the state and add expertise to the committee. And as I had already mentioned, staff worked to recruit folks from Western Maryland. So today I present to you 2 additional individuals who applied to the committee for 2023 since our last meeting. At that meeting, SAC co-chair John Frank presented 7 applicants to the board. They were approved. Now, Mr. Frank and I have since met virtually with staff and approved these 2 applicants. We reviewed them though. We reviewed and approved them. We recommend that the board appoint them to the Standing Advisory Committee. They are Carmen Larson. She's from Montgomery County, the region being Capital North, and she's president of the Hispanic Chamber of Commerce, Montgomery County. And then Dr. Douglas Spots. He's a VP, Chief Health Officer for Meritus Health, and he's from the Western region, specifically Washington County. He's a healthcare provider and a health system executive. So to the next slide. So I move that the board approve the appointment of these individuals to the Standing Advisory Committee as presented. But before we do that, are there any questions?
Second first, and I'll second.
Okay. Did you catch that? Oh, you seconded, yes.
So there's a motion on the table, and a second in discussion.
Any discussion? It's okay. It's all good. We're working through this. It's my first time. All those in favor?
Aye.
Aye.
And any opposed? Motion carries. So next on the list, we're going to hear from Sharon Merriweather, Principal Counsel on the Board of Trustee bylaws modification, proposed modification.
Good afternoon, Board Chair and Board members. Thank you for the opportunity to present this afternoon. As Dana mentioned, the Policy Committee met on the 20th of March to discuss amending the board's bylaws. The bylaws have not been amended since they were adopted in 2011, so there was just really an overview, a review of them to see if there's anything that needed to be changed, either because it wasn't how the board was actually acting, or whether any laws or anything changed that would require change to the bylaws. So what was determined is that, and the other thing, just to back up, there was one other thing that the Policy Committee wanted to do, was to see if there were any changes that were necessary based on kind of the changing way the world is working now. So whether remote meetings, hybrid meetings would be permitted with the bylaws, in addition to any changes that may be decided on the board as far as the cadence or the frequency of the board meetings. So after the review, the committee has recommended to remove Article 2, Section 4 of the bylaws, which requires the board chair to appoint a treasurer. And the rationale was that this position is not now or currently appointed, and that the duties of the treasurer were not clearly defined, and that currently the Audit Finance Committee meets quarterly to oversee the exchange's financial reporting process and systems for internal control over the financial reporting for the board. The next section was Article 3, Section 4, and the recommendation was that be modified to be consistent with current law. And this provision in particular required the board's approval for creating or abolishing staff positions. And it also, so that is not required by the law. But I did want to point out that any such actions by the executive director are limited to positions that are unique to the exchange. So if they're not unique to the exchange, the board would have to, the executive director would have to report them to DBM, and they would be approved by DBM. And
Sharon, can I ask an example of those positions that would have to go to DBM?
Yeah, so those positions that are unique to the exchange, I believe, are limited to positions in the policy department. There was a review by our human resources and DBM, and those at this point are the only positions that would be. And I think I
just
spoke.
Plan management.
Plan management
are the only ones, and that because when the exchange was created, we have a plan management department that interfaces with the insurance carriers. That's unique to the exchange. That's the only role.
So to clarify, anything else you want to do, eliminate positions or et cetera, needs to go through Department of Budget and Management? What I understand?
Yeah, I misspoke a little bit. So the board does not need to approve those changes. Now, the way it was written previously, it required the board's approval and for all of the positions, but that has now been limited to only the plan management positions or the positions unique to the exchange. And those still need to go through DBM, but that's the limited nature of where the executive director has the authority to make those changes. The next one that deals with personnel is then the law changed somewhat in 2014. There was much more discretion that the exchange was allowed when it was first established. And some of that discretion regarding personnel has been limited somewhat. So the authority to determine the classification, grade, and compensation is limited again to those positions that are unique to the exchange, those plan management positions. So, so at this point, the executive director can make recommendations to those, but they still need to go through DBM, but it's limited to not all positions of the exchange, but just those positions that are unique to the exchange. So that clarification was made as well. The next section we moved to was Article 4, Section 3, and that section is recommended to be removed. And that section is regarding the Advisory Process Committee. Now, this committee conceptually would be established, the purpose is to establish the mission, scope of work, and size and composition of other advisory committees. This committee, as far as I know, has never been up and running. There is one advisory committee, that's a standing advisory committee. That committee is specified in statute. And the exchange has a process now for which, and we just heard Dana report on how those members are selected. So the Advisory Process Committee doesn't appear to be needed, but it's certainly something that the Policy Committee could take on. If there were a suggestion that there be additional advisory committees, there is the authority of that in the statute. So that could be done that way. It's also important to mention that the Advisory Process Committee is not mandated by the enabling statute. So those are the 4 changes, either deletions or modifications. And the committee also reviewed those provisions that dealt with in-person meetings and the frequency of meetings. And they determined that no changes were needed for those provisions because they already allowed the flexibility for virtual attendance. And I think a minimum of 6 meetings. The board now meets 9 times. So if they wanted to change that or lessen that to at least 6 times, that would be feasible, but it still is, the minimum is 6 times. And that's all I have. But I did want to just clarify that today we're not asking for a vote from the board. There is a minimum number of days that the board has to consider bylaws changes, so that we'll be back next month for the actual vote on those suggested modifications. It'll give you time to look at them and decide if you certainly agree with them or not. But at this point, if there are any questions.
So back to the treasurer piece. So there's nothing in the regs that require us to have a treasurer, and there's nothing in the state code. I know we're required to have a board chair, a president, and a secretary, but nothing that.
So in the enabling statute for the exchange, there's nothing that is, a treasurer is not required.
And if I recall, part of that discussion was that the Audit and Policy Committee, Audit and Finance Committee was essentially acting as a chair, and we do receive reports from that committee. So that's the roles kind of.
So a question about standing committees in our bylaws. there's some call out of a standing committee. Does the board have the ability to establish additional standing committees without, even though they're not specifically defined in the bylaws?
So yes, there is provision in the bylaws and in the statute for the board to establish additional committees.
I have a suggestion to make. I'm not tied to this specifically, but as Michelle mentioned, we're bringing on board a new compliance officer. We've always said that the compliance officer has a dotted line relationship to the board, although never defined exactly what that means. Quite obviously, the financial and sort of stewardship requirements of the board are very important. Therefore, I guess I'm going to say I recommend that over the next several months, either the policy committee or the audit finance committee decide if we need to make clearer what the relationship is, and if we do, what it needs to be, so that that is a bit more specific than it is now, if the board so chooses. My own view is that it does need to be a bit more specific, but I'll leave that to the board itself.
I would agree with that. Thank you.
I do too. I would suggest for efficiency's sake, perhaps the two committees could have a Zoom meeting and discuss just that issue, so we can hear it from the finance and audit people, and you guys can hear it from the policy people.
And I think obviously Michelle needs to be involved.
Absolutely.
Because I think that's, I mean, you don't want to undermine the executive director, but on the other hand, in the highly unlikely, and obviously where I'm coming from here, highly unlikely chance that there's something going on, we need to be sure that I think we need to be sure that there's a way that the compliance officer can interact with the board in a what I'll call protected fashion.
That's certainly something that can be considered for the bylaws. My suggestion is, if that is something that the policy committee wants to take up and consider, that we do it all together. You don't want to, monthly or every other month, mess with the bylaws. That should be done rarely. So if there are additional considerations for the bylaws, for any modifications or changes, my suggestion is that they be done and considered together.
I have a question whether that actually needs to be an amendment to the bylaws, or can it be a practice or something not codified in the bylaws, but an operational policy procedure?
We do have an operational policy document or something like that, do we not?
We do.
Again, I think that's up to the two committees, but I'm agnostic on which one it should be, but I do think it's important to have it documented someplace. And I think that's as far as we can go today.
And then I'll just add that is in the first 2 weeks for the new compliance officer is to take all the compliance policies and review them all and make recommendations, so that it's already on the plate to look at.
Any other questions from members on the phone?
One question, this is Synctonasia. The state has many commissions and many other similar bodies like this. Is there anything unique in our bylaws or not in our bylaws that is a consistent requirement?
I missed that last part, if anyone can clarify. You got clipped out, I think. Sure.
So I said the state has many commissions and other similar bodies like the exchange. Are there any things in our bylaws or not in our bylaws that are consistent with the other commissions, state of Maryland?
I have not reviewed any other bylaws. I will say that the exchange is not a commission. It's different than that. It's a independent state agency, and what's considered a public corporation. So there are others that are similar, but they're all they're all enabled by statute. And I have reviewed the statutes of other independent agencies, and there are some changes. Generally, these statutes say what state laws are required, the body is required to comply with. And like I was talking about the personnel, what parts of the personnel article the body is required to comply with. I think the exchange is pretty much in the middle as far as independence from procurement law, personnel law. There are some that have much more autonomy, and then there are others that have less.
Thank you.
Any other questions? Thank you, Sharon. Next on the agenda, we'll hear from Johanna Fabian Marks to get the 2023 legislative session update.
Thank you. So happy to share an update on the bills that we were tracking this past legislative session, which just wrapped up last week. I'll first cover 3 bills that passed that we were keeping our eyes on, and then the next slide deals with bills that did not pass. So for bills that passed, I'll start with House Bill 111. This one doesn't directly reference the exchange, but we will be working with other state agencies to implement it. It directs the health department to use SNAP eligibility findings to expedite Medicaid eligibility determinations, prioritizing that effort first for Medicaid renewals and then for initial enrollment. And that whole effort in the law is subject to the limitations of the state budget and is permitted by federal law. So there's certainly, I think, some further work to be done on that, but we'll be looking forward to working with MDH and Department of Human Services on that initiative. The next bill I'll mention is House Bill 814, which extends the Young Adult Subsidy Program for an additional 2 years through 2025. So as many of you will know, that is an existing 2-year pilot program that was put in place for 2022 and 2023 to provide state funds to reduce health insurance premiums for young adults between the ages of 18 and up to 40. The parameters that we put in place make those funds available for young adults 18 to 34. But so that program would have ended at the end of this year. It's being extended for an additional 2 years. There are no other changes to the program. It continues to be funded with a maximum of $20 million per year. The eligibility parameters continue to be the same. The one addition in the legislation is to require submission of a study in consultation with the Insurance Administration to the legislature by December of 2024, exploring the impact of the program and some recommendations for how to move forward.
Johanna, the 814 money, that doesn't come out of general funds, though, does it?
No, it comes out of state funds, specifically the 1% assessment that funds reinsurance, also funds the Young Adult Subsidy Program. And then the last bill I'll mention is Senate Bill 806. This requires the Department of Health and the Exchange to work together to submit a report to the legislature by October of this year, comparing options for offering affordable coverage to residents who are ineligible for coverage through Maryland Health Connection due to their immigration status. This really builds on a report that the Exchange submitted a couple years ago, in which we explored options for offering coverage, as Chair Peña-Melnick mentioned earlier, through the Exchange. This is sort of part 2 of that, to look more specifically at possibilities and costs of using state funds to provide Medicaid coverage to individuals. So we've kind of got the Exchange piece, then we'll have the Medicaid piece. That'll be kind of a full universe of how we could use existing programs to cover these individuals. Any questions on those before I move on?
I see they all went to the governor. Is he expected to sign?
Yes, we do expect him to sign them.
So I had,
yes.
Let me know if this is the right, this is Synctonasia, right time. I think SB 806 it was mentioned that it did not go through the approval process of the Senate. Do we know what are some of the reasons it did not go through that process?
So that I'm actually going to address on my next slide. Senate Bill 806, which is just a study bill, did pass both the House and the Senate, but the Access to Care Act did not pass. That's the one that would have directed the exchange to apply for a waiver amendment. So the simple study bill did pass. There were not issues with that, but the more complex one did not. So I'll definitely address that in my next slide.
Thank you.
So that'll be the last of the items that I'll go into a little bit more depth on. But before that, Senate Bill 59, House Bill 107 is the first bill I'll mention we were tracking that did not move forward. That would have allocated an additional $5 million a year to the exchange for 5 years for marketing outreach and programs for small businesses and nonprofits. This legislation was an outgrowth of recommendations of the 2022 Small Business and Nonprofit Health Insurance Subsidies Program Work Group, which was established by the legislature last session to examine the feasibility of implementing a subsidy specifically for small business premiums. That work group ultimately concluded, as we previously shared with the board, that it didn't make sense to implement a state subsidy on the small business side at this time because individual coverage is so affordable with both our reinsurance program and the level of federal subsidies currently available. But they did support increased marketing and outreach to small businesses to educate them about their current options for coverage. So this legislation was proposed pursuant to those recommendations. It did not move forward mainly because the funding outlook for the state was not as rosy as had been hoped. And so I think many initiatives that required additional funding were tabled this year. But I will say that we do intend to use our existing resources and work with other state agencies to increase our outreach, and in conjunction with our recently hired new small business outreach manager and small business programs manager, we have kind of staffed up to do more on this front. The next bill I'll mention that didn't move forward was Senate Bill 843 and House Bill 915. This was a little bit of a left field bill for the exchange, but it created a climate change adaptation and mitigation fund using what the bill termed cost recovery from fossil fuel companies. And the bill would have earmarked 20% of revenues recouped through that program for the exchange to provide financial assistance to populations with high rates of uninsurance and individuals ineligible for federal assistance, namely that would be undocumented individuals. So that didn't make it out of committee in either chamber, but we're always happy to see people thinking of us when they're thinking about how to support health insurance affordability. And then the last bill I'll mention and go into more depth on is Senate Bill 365 and House Bill 588, which, as we heard from Chair Penny-Melnick and Vice Chair Cullison, would have directed the exchange to submit a 1332 waiver amendment to allow Maryland residents to enroll in private plans regardless of their immigration status. And it would have also authorized the exchange to administer a state subsidy program to support affordability of coverage for this population if state funds were available. So just a little bit of background, I think as Chair Penny-Melnick might have mentioned, there's about 360,000 uninsured individuals in Maryland. About a third of those we estimate are undocumented individuals. Federal law prohibits undocumented individuals from enrolling in private coverage or Medicaid through the exchange, but that is a waivable provision. So using our 1332 waiver authority, we could potentially get a waiver from that to allow undocumented individuals to enroll. They still would not be eligible for federal financial assistance through the exchange. So any financial assistance made available to them would have to come from state funds. There's no way to waive anything that would get federal money to support them. As I mentioned, in 2021, the legislature asked us to study what it would cost to provide state funding equivalent to the federal funding that we do administer. So we submitted that in November 2021. and then in 2022, last year, Delegate Pena-Melnick and Senator Lamb introduced bills that would have authorized the exchange to apply for a waiver amendment to allow undocumented residents to purchase on exchange. It didn't move forward last year. Those bills were re-proposed this year. And as was mentioned, they would allow for a state subsidy program if funding was available. Funding was not identified in the course of session. So I think kind of staff's operating assumption was that if these pass, we would apply for the waiver, but we would not be setting up a subsidy program until potentially some future point when state funding was identified. So the House bill passed and was referred to the Senate Finance Committee. The Senate bill didn't move forward. The Senate Finance Committee ultimately did not move the House bill forward. And the reasons expressed were that the chair and a number of the new committee members were new to Senate Finance this year, and they both wanted a little bit more time to kind of understand the issue. And also they wanted to wait for the Medicaid study bill that I previously mentioned that's due later this year to be completed and submitted so that they had both studies in hand when they were thinking about how to move forward with coverage for the undocumented. So as you've heard, because the legislation did not pass this session, there is now interest in whether the exchange can apply for a 1332 waiver amendment absent authorizing legislation. And federal law requires that a state demonstrate it has legal authority to apply for a 1332 waiver or waiver amendment. That authority under federal regulation can come from either a state law explicitly authorizing the waiver or from state legislation that provides authority to enforce the ACA, which the exchange has, in combination with the relevant state regulation, which we don't have at this time. At the staff level, we reached out to the Centers for Medicare and Medicaid Services to discuss this issue with them. And they shared that to date, all states that have applied for 1332 waivers and amendments have done so pursuant to state legislation. No one's used the kind of existing authority plus regulation route. So although that is contemplated in federal law, they couldn't commit that something that we would put forward with that combination of authority would be sufficient from their perspective. Basically said they needed more time to consider the issue with their lawyers, and potentially they would need to see the proposed regulation itself before they could advise. They did advise that Senate Bill 365 and House Bill 588, if they passed, would be sufficient authority for the exchange. So in terms of thinking about next steps, given kind of where we are with all that taken into consideration, if the board did want to pursue a waiver amendment in time for the 2025 plan year, we would need to start that immediately. We'd essentially need to start drafting a regulation now. And that kind of, you know, we have a whole timeline that would carry us through to submitting the application next March, but kind of have to dive into that now. In kind of at the same time as, you know, these conversations have been proceeding, we're also working with the Insurance Administration and the Maryland Healthcare Commission on a report required by House Bill 413 of last year. That's the bill that extended the 1% assessment that funds the reinsurance program. It also required us, the Insurance Administration and MHCC, to submit a report on a number of things, including what we think the future of the reinsurance program should look like, and then more broadly, affordability initiatives and initiatives to expand coverage that the state should consider, including through waiver amendments. So that report is due the end of December. As I mentioned several times, we also have the report with MDH on coverage through Medicaid due the end of this year. And so considering all those studies in play, there's sort of two options. The board could choose to dive in now, or staff would, you know, my recommendation would be more so to wait and kind of reconsider this matter at the end of the year when we've completed the House Bill 13 study. We've completed the Medicaid study. The downside of waiting is that, well, the upside is that we have all that information, and the legislature could potentially pursue a more holistic set of legislation considering waiver amendments, both related to potentially allowing the undocumented individuals to enroll and anything else that may come out of the HB 413 work group and report. But the downside is that that would push back implementation of allowing undocumented individuals onto the exchange probably by a year. So we'd be looking at coverage starting in 2026 rather than 2025. So that's kind of my presentation on that matter.
Thank you, Johanna. Questions, Dan?
Comment and a question. Comment. I would like to see what you just presented to us, not all of it, but the part about the undocumented be on the agenda for the next standing advisory committee. We have some health researchers on that committee. The next question, did anyone who gave testimony in favor of this part, these bills, did anyone give financial savings from covering people with health insurance as opposed to them not having anything and then having to deal with the acute problem? And yes, if yes, could you share it with the board?
So as you mentioned, there is certainly a cost to having uninsured individuals in the context of uncompensated care at hospitals. I believe the Maryland Hospital Association might have provided some estimates. I'll double check that, and if so, share them.
Thank you. Thank you.
Any other questions, Ben?
Yes.
So,
go ahead, Ben.
So I have one observation about the regulatory process, and it sounds like staff is kind of leaning against that anyway. But given that a bill was introduced and didn't pass, I think there would be some question about whether the regulatory route was, of pure heart or an attempt to circumvent, the preferences of the legislature. But my biggest remark will be, if you look at the hearing on 588, I don't think there was anyone that opposed it, as I recall, the Healthcare Commission, MHBE, but a ton of advocates all weighed in. And that does raise a question about what the role of the exchange should be. Should we have been more, aggressive leading up to, and recognizing that, of course, the administration's changed and the Hogan administration's position may not have been, as strongly in favor of this. But I do think that there's opportunities, and especially if we go the route again of working with sponsors to reintroduce it, to do more. I wouldn't call it marketing, but I would call it education to the members. Because when I looked at, in the House, apparently the only people that were worried seemed to have sat on the Senate Finance Committee, and it was an opportunity that I think, even in spite of more difficult financial outlook, that we might have missed. So I just leave it at that. But I think we need to muster all the information we have for the future next step.
Singh-Taneja, a couple of comments. One is that previously it was mentioned that these are tax-paying. So my question was, individuals should have the opportunity to get health insurance employers. So why many of these individuals don't have that health insurance to their employers? That was one. The second one was the study, the cost aspect of it. How much will it cost the state based upon those assumptions that was done? The third question I have, I lay them all at one time. I heard that we do have governor's support on this one. So I think that's a good thing to have. And the fourth and the last one, which Ben referred to, was if we were to proceed with this, trying to bypass the legislative process, what are the consequences for the exchange when we try to do that?
All right. So in terms of the question about individuals having coverage through employers, I don't have the numbers in front of me, but our estimates based on looking at census data are that the majority of undocumented individuals do get coverage through their employers, but there's still a large percentage that don't. And that's the 120,000 individuals that are undocumented and uninsured. In terms of the cost question, so when we modeled what the cost would be if the state provided financial assistance that's equivalent to what the federal government provides, we assumed that about 30% of undocumented individuals would take up coverage. So that's key to the cost estimate. And that therefore the cost would be about $150 million a year in state funds. Now the exchange can allow individuals to enroll in coverage and not make funding available to them. And that has a very minimal implementation cost, maybe $1 million. So that's a pretty small cost to just allow them in. And I should also note, which I didn't, undocumented individuals can enroll off exchange and insurance and private plans. There's nothing prohibiting them from doing that. The benefit to being able to enroll on exchange, even if you're not eligible for financial assistance, is that if you're in a mixed status household where you perhaps have children or a spouse who's legally present and eligible for financial assistance, they can enroll on exchange, get that assistance, and you could enroll on exchange without assistance, but be in the same plan as them. So that would be one advantage. And then the last thing I think that you had asked regarding consequences if the board moved forward. I mean, I think in the most practical sense, we're not sure. CMS wouldn't really commit to whether they would approve an amendment using the authority plus regulation route. So it's possible that the state could apply and CMS would come back and say, we don't think that's sufficient. We really think you need legislation, but we don't know.
Well, my concern was the consequences. We are bypassing what the Senate did not approve, at least not in this legislative session. And if finances were one of the concerns, adding $150 million to the budget, bypassing them. If I'm one of the members from the Senate, I would be concerned that it did not have an opportunity through their processes.
Mary Jane?
Couple of questions. One is, I think you said any regulatory thing wouldn't happen until next March to get through the process. Is that what I understand? We'd start the regulatory process now, but the application to CMS would be probably submitted in February or March. It would have to be submitted by March. So to be able to go into effect for a December or a January 1st? Yes, for January 1st. And it's a hard deadline for that. We couldn't both do the regulation, do the application at the same time, work to promote the bills. So it was sort of a two-pronged approach to say, you approve this, we're ready to go, we can submit April 15th, right after sine die. Hopefully the governor would sign it that night and we're early. The question is, what's the absolute latest? Because no matter what, you'd still have to do the application, right? Right. So if you had the application done at the same time, you're pushing for the bill.
So it's really up to CMS. Their guidance says they have to be submitted by March 30th. But for example, when we put together the reinsurance program, they worked with us to do that in a more compressed manner.
We're talking about 2 weeks or so, whether whether it had passed finally. And do we know whether Senator Ferguson supported this or not? Because ultimately that would determine whether it was going to come to the Senate floor.
I think I'll defer to.
Well, I'm going to Delegate Pena-Melnick or Chair Pena-Melnick wants to address the political question, so I'm going to give her a moment to speak. Okay. Chair Pena-Melnick.
Thank you, Chairwoman. So we got a letter from, I actually requested a letter, confidential letter from the Attorney General, basically asking, can the exchange submit without legislation? The Attorney General wrote a letter saying, yes, the exchange can submit without legislation. I met with Senator Ferguson and I asked him to pass the bill. He basically said that his chair was new, and she's new to the Finance Committee, and did not feel comfortable passing the bill at the moment. However, he said to me in that same conversation, the exchange does not need legislation. Why don't they submit without it? And I have asked a letter from him and a letter from the speaker asking the exchange to submit it without legislation. And we're waiting for those letters to be signed. So that, and whether the Senate is gonna get upset, I don't think that's really, with all due respect, an issue here, because oftentimes, a bill takes 2 houses to pass. Sometimes they don't pass, not because people don't support it. It could be that they need more time. And there's going to be times when, frankly, all the bills that we pass, including creating the exchange, the stabilizing the individual insurance market, the subsidies, there were people that didn't vote for it. We still passed it because of all the data that it shows that this is the right thing to do. I respectfully would say that the Senate is not going to get upset if you were to submit without it, because Senator Ferguson himself told me, why doesn't the exchange submit it without legislation? And he says, I've been told that they can. So he was encouraging it. Thank you so much for allowing me a few minutes.
Thank you. If we were to start the process now, given staff issues and all of that, is there anything that has to go forward to CMS for April next year? Other than pro forma notifications where something might be coming, but an official document, does anything have to go forward that would commit the state to it before April of next year?
We are supposed to submit a letter of intent, which is non-binding in September, to indicate our plan to submit an application.
Would a letter that said, we're thinking about it pending on what the legislature does, be a sufficient letter of intent, do you think? What I'm trying to get at is, obviously we need to do this, but I'm not comfortable with my limited time left. You haven't heard from the chair of the committee at all. There's lots of issues here, and there's lots of, I'm perfectly happy in public, but in private, I mean, I've worked in both the House and the Senate in federal level, so politicians are wonderful people, period. But I do think that you have to be sensitive to that. On the other hand, if we can move forward without committing the state in a way that would potentially discommode the Senate, I think we ought to think about it. And again, whether we have the staff capability, given what the other things you have to do and so forth, that's a second issue and one we certainly have to consider. But if on the other hand, there has to be a commitment of some kind, that in effect, as Ben noted, that we would in effect be circumventing the Senate, I think we've got to be very sensitive.
So I'm going to propose, this is not on the agenda for voting today. This was just an update, and there's clearly a lot of outstanding questions that need to be answered, including CMS's position on this. So, go ahead, Ben. Oh, okay. So I'm going to propose that we keep it on the agenda for June. We come back with more information, and then we can figure out next steps from there. I need a formal motion for that. Okay.
Thank you.
Thank you, Johanna. Okay, with that, we'll move on to Betsy Plunkett to hear about marketing services option year 2.
Good afternoon. Thanks for having me. We're going to talk about
2 marketing contracts, which are entering into their 2nd and final option year.
Communication and Marketing Services contract, MHBE contract with GMMB for full service communication and marketing, including marketing communication strategy support, advertising, creative services, social media, outreach, education, user experience, testing, web designs, and support, just to name a few. 5.
So each year we have research that drives our creative execution. This year was a little different because we weren't sure about rates and the Inflation Reduction Act. So we suspected we wouldn't go on cost. And on the heels of COVID, our consumers felt the same way. More than ever, they were worried about what happens when things they don't prepare for happen, the unexpected. So we did a number of humorous and relatable left hooks to remind people of the value of keeping their health coverage. Here are just a few examples that we ran on websites, paid social media, in print and television. So we had a few different media placements than we usually did. The World Cup was a great opportunity, good timing for our Hispanic audience, especially. So we ran ads on Telemundo featuring 15-second ads in English and Spanish. And we also ran programming during Ravens games. We had a mall partnership during the holiday shopping season, gym TV, pharmacies, and doctors' offices. We also had placements on radio, as always, and took advantage of our partnerships with Facebook Live integrations as well. We had placements with several display ads, web content on Hulu and YouTube. Social, we did placements on TikTok, Facebook, and Instagram. And then in print, we, as always, made sure that the ethnic weekly newspapers and monthly newspapers in those communities had ads running as well. So here are just a few social media highlights. We prepare something we call the social press kit, and we send that out to our partners and encourage them to share our different posts and make it very easy for them to put things on their own social media channels, and it also helps reinforce our messaging. Here's a few collateral highlights that GMMB did the design for. So they did the calendar, we do a template event flyer for our consumer assistance organizations so that they can drop in their own information. The Palm card now doesn't have dates on it. It has a QR code so that whenever it gets into someone's hands, whether it be in an event or a hospital or library, they always have accurate information because they're pointed to our website. And we also did a couple videos in American Sign Language. We introduced WhatsApp as a partner tool. A lot of our Hispanic partners had asked us if we were going to do anything with WhatsApp because that's their main driver of communications. It's not a consumer assistance opportunity, but rather a way to push out correct information in Spanish. And then we also did a number of events and partnerships. This is a very short list of many things we did across the state. We had social influencers, and again, this is just a sampling, but 2 new ones as of last year were Ravens player Geno Stone, who has turned out to be a superstar if you're a Ravens fan. And we also have a Washington Commanders player, Trey Turner. They both have very high followers, and we got them right as soon as they were drafted, and they have continued to grow. So it turned out to be a great relationship. And then we also had Kylila Wright, who has a big following, and she reached 100,000 accounts with some of her posts. So. We had a lot of earned media placement through radio stations, print, and on TV stations. And our kickoff for open enrollment is usually one of the biggest drivers of earned media. And then the ending of the open enrollment always gets a lot of press as well.
Contract terms not to exceed amount of $4,060,000 for FY24 as allocated and approved budget for FY24 budget. Total contract cost for 3 years was $12,180,000, and the breakdown is below. Base term was for 1 year, and then they had 2 one-year options. MHBE requests the board to approve its final last option year for marketing communications contract with GMMB from July 1, 2023 to June 30, 2024 for an amount of $4,060,000.
I move to exercise the second option year renewal for the marketing communication contract with GMMB from July 1st, 2023 to June 30th, 2024 for an amount of $4,060,000 as presented.
Second.
Is there a second? Thank you. Any discussion?
I'll just make a comment. Those guys did a great job, especially this year. I'm sure they always have done a good job, but I really noticed them everywhere this time.
Thank you. Pass it on. All in favor?
Aye.
Aye. Thank you. Any opposed? Motion carries.
Printing services contract. Art and Negative provides printing services to support the agency's marketing efforts, including some of the items we have listed here: postcards, letterheads, brochures, envelopes, flyers, posters, bookmarks. Okay, good.
So this is Art Negative. They're in the second option year as well. Their name may sound familiar because they also have our huge fulfillment contract. So this is separate and apart from that. This is just for marketing services. And they've printed, you'll see some duplicates here from GMMB designed them, and then we went on to use Art Negative as our printer.
Contract terms not to exceed the amount of $120,000 for FY23. The base term here again was for 1 year, and then they had 2 one-year options. We're asking that the second and final options be renewed. And the breakdown per year is state funds was $62,200 and federal funds was $52,800. So, MHBE requests the board to approve to exercise the second and final option renewal for printing contract with Art and Negative Graphics from July 1, 2023, I should say, to June 30th, 2024 for an amount of $120,000.
I move to approve to exercise the second option year renewal of the printing contract with Art and Negative Graphics from July 1st, 2023 to June 30th, 2024 for an amount of $120,000 as presented.
Second.
Second.
Any discussion? Any discussion? All in favor?
Aye.
Aye.
Any opposed? Motion carries. Thank you.
Thank you very much.
Thank you. Next, we'll hear from Venkat Koshanam on the IDIQ task order approval.
Good afternoon, Madam Chair, Vice Chair, members of the board, and everybody. Today I'm joined by our procurement officer, Cheryl Green. We are going to request the board for approval of.
Give me a minute. She didn't download it. Sorry. Maybe I can run it from here. Well, I don't know if people on the phone will see it. I'm not sure.
Share my screen, they should be.
Go ahead. Probably supposed to see it. Ask them.
Or do you have it there on the?
I have to put it in here. I can do it. 1 second.
Thank you. Yes. Today I'm joined by Procurement Officer Cheryl Green to request the board for approval of 2 items. One is the IDIQ not to exceed amount for the fiscal year 2024. And the second item is to approve certain task orders to be issued under the ITID contract for the fiscal year 2024.
I was just going to say, I'm not sharing it. I just realized that.
Sorry, Ben. Yeah.
All right. Thank you. So today, Cheryl is going to give an overview of the contract, just as an introduction, and then I'll give a brief update on technology, why we need this contract, and what's in store for us in fiscal year 2024. And also, I'll give a very brief summary of the budget involved, and then hand it out back to Cheryl again to describe more about the procurement process and what we are requesting the approval for. So with that, I will hand it over to Cheryl.
Actually, maybe let's hold for one moment.
See if we can get it up on.
Yeah.
That should be right now.
Yes, that's it. Thank you.
Sorry about that.
Yes, that's the first page. The ITID-IQ contract review is listed up here, and it's based. I'm just a brief snapshot of what's going on with the contract and what we project to do moving forward with it. The master contract, we procured 110 master vendors who were selected to provide services under the IDIQ master contract for 5 years, from July 1, 2023 to June 30th, 2028. The contract base period is for 3 years, and we have 2 one-year options. Resource hiring, we have 155 IT contract staff under various functional areas. The budget for FY24 IDIQ is $34 million roughly. Next slide. Here are some of the functional areas that we have good services for. We have 10, should be familiar with these because we had them the last 8 years already. So next slide, please. The technology overview, Van Cat will discuss the many services that we provide using the IDIQ.
Thank you, Cheryl. Very briefly, I think board is familiar with this slide as well as the contents. I just wanted to give a brief introduction of what technology is for the exchange. In a nutshell, when we say on the top left, you see web apps. It's a web application. Basically, it consists of the consumer portal where our 1.3 million consumers log in and get the end-to-end service from requesting for insurance coverage, looking at the rates and getting determined for eligibility and plan shopping, and also sending the transaction across our carriers and MCOs and our partners, Department of Health and Department of Human Services, etc. So this end-to-end system is our consumer portal. And we have another portal called Worker Portal, which is used by our workers and the call center workers and MDH partners. And this is very tightly integrated system. And also we have a marketing portal our marketing team uses. And also we have a broker portal that our brokers utilize that. All of these systems talk to each other very closely. And we also have a small version of the small business health option. Down the line, the plan is to in FY24 and 25 to enhance that platform. And we do have certain integrations with the Maryland Department of Health for presumptive eligibility related services as well. And the consumer portal's end-to-end version is also on the mobile app. And I think we are the only 2 state-based exchanges besides California to have the end-to-end option. And 65% of our consumer traffic is now going through mobile app and the mobile devices. And that's pretty significant. And so we do strategize around that in terms of consumer traffic and how we can engage with our consumers using these devices. And CRM is an application. Salesforce is the software that we are using. And the board approved the software last board meeting. Thanks for that. And it's a very tightly integrated application as well. And we nearly address nearly 1 million consumer queries every year. And this application is not a standalone. We have very tightly integrated with HBX and our other internal applications as well. And this year and last year also, we have focused more on enterprise automation. And we are probably the only state agency at this time to use robotic process automation to automate several business processes. We started very small. We started with the so-called 8001 Medicaid transaction automation, and then we evolved to automating certain private health plan QHP plan validation. And then we implemented some security-related automation. And last year and now we have implemented validating consumer documents for Medicaid and QHP eligibility determination. And we did win a CIO 100 award in 2022 for this specific initiative, which was our 4th time. And we also moved to AI-based technologies, and we have a chatbot. It's not quite AI, but we will be getting there. And this chatbot provides basic consumer query responses and reduces several calls for the call center for basic questions. And we did integrate the chatbot inside the consumer portal also. And we also implemented last year a live agent chat functionality where consumer can click a button and connect to the call center workers. And we also moved the live agent inside the consumer portal. The real use for that is when consumers are navigating through this application flow of getting the insurance coverage, they can just click a button and connect to a call center worker to seek any questions. And very interestingly, actually, 35 to 50% of our traffic in the last month, it's very early stages, but we do see in the live agent chat connected to the consumer portal. That's very encouraging. In the coming year, we are talking about more of integrating conversational AI and potentially natural language processing into this as well. All of these efforts are done internally by our team, 168 ID staff, 155 of our consulting staff. That's what we are requesting for the IDIQ approval for today, and 13 state staff, including myself. And the staff covers the various functions, PMO, application development, and special projects where we develop our innovative initiatives, and mobile apps, Salesforce, testing, QA, EDI. And also we are expanding the data and reporting functionality now to provide the exchange data analytics capability next year. That's a very interesting and very useful project specifically for our policy team and operations team. And we would continue to look into AI and RPA processes and expand those initiatives as well. And security and infrastructure obviously is a very, very important concern for us. And also the disaster recovery and business continuity efforts are important as well, which I will very briefly touch upon in the next slide. This is a quick look. I won't bother everyone with the details, but our systems are very tightly integrated with various state and federal organizations, DHS, MDH, Labor Department, Comptroller, and Federal Hub, and carriers and call center systems are very tightly integrated as well. Next slide, please. This is a quick look at our strategy for FY24. This is similar to what I presented some time back with some updates. Obviously, the cyber security is #1 for us. And last time when I presented the board about this particular initiative several months back, we talked about zero trust framework implementation. We are pretty close to completing it. We are slightly ahead of schedule, actually. We are anticipated to complete by June of this year. Probably we'll do slightly before that. And next year, we're going to enhance further in terms of security. And also we'll be focusing on more on disaster recovery and business continuity related services. And we are currently working with our MD Think partner. Unfortunately, we couldn't get much traction last year. We are really hoping to have some movement this year. And we did meet Michelle and Andy and myself, met with the DOIT secretary and met with our secretary as well. And also Michelle talked to the DHS secretary as well. And we also talked to MD Think, acting executive director currently. So we do see some traction and openness in looking into these initiatives and supporting us this year. I will provide the board more updates as we go along.
And the business continuity and disaster recovery are separate AWS.
That is right. Correct. And as you know, business continuity is a lot more than in terms of technology, but definitely in terms of technology, yes, some separate areas.
Disaster recovery is incredibly important for us.
Thank you. And the second is innovation. We continue to innovate. Our goal is to engage with consumers more. Seeking insurance, getting coverage is a very complex process for anyone. And I always say, I always use my teenage daughter to check it out. And I don't really get very great results sometimes. So I take it as an incentive to do better. And we are going to implement data analytics platform internally for our stakeholders and also MDH partners when we want to look into the data and analyze. For instance, if we can overlay enrollment data with call center data, with web data on top of it, CRM data, you can certainly see a picture of a variety of scenarios, and we can definitely look into those scenarios and address disparities in many things, including technology-related services as well. So that's one of the key projects for this year. And in terms of collaboration, as Johanna pointed out, we would be working with our state partners to integrate our systems more. Obviously, 1, 2, and 3 will not work if operations are not good. We are continue to focus on operational excellence. And we are in the phase of public health emergency unwinding. Our team is focused on a smooth transition. We very closely work with MDH and DHS partners on this effort as well. And we continue to implement policies and system enhancements in a very rapid style. And we continue to maintain that pace as well. Next slide, please. These are some of these initiatives which I can talk detail in later when I come to the board, back to the board for some updates. Again, the focus is more on security and more on consumer engagement and developing and implementing solutions at scale and speed, and also giving a great experience for consumers utilizing a lot of newer technologies. Next slide, please. And this is a glimpse of our IT roadmap for fiscal year 2024. As you can see, there are 4 streams of releases. One is special projects and enhancements and M&O, maintenance operations, and Salesforce. Every month we will have a major release, meaning 30 to 40 different scope items, potentially spanning across eligibility and enrollment related technology modernization, special projects, integrations, etc., and also security related items. We work very closely with the CMS partner. So our scope items are very tightly aligned with what we tell CMS that we will do. And that's what we do. And thankfully, in the last several years, we never had a single question in terms of when we sought for funding approval. We were always being encouraged to innovate and provide continuous services as we do currently. This is just a glimpse, and I would be very happy to provide more details if you require. This is a snapshot of our budget. I would explain this and pause here for any questions, and then after that, I will hand it over to procurement officer. So this is a comparison of total budget for IDIQ between fiscal year 23 and fiscal year 24. As you can see, actually it's pretty close, slightly lower in terms of the total budget for IDIQ. And one of the reasons is, even though cost inflation is higher, since it's a new contract, we anticipate some reduction in cost in terms of overall net rate per resource, per technology specific skill set. That's one reason. We would like to keep the level of staffing at it right now. And also there are other reasons in terms of project, which I will briefly talk about as well. As you can see from federal and state participation, there is a reduction of federal participation this year, but increase of state participation, nearly $1 million less in federal participation, $750,000 more in state participation. I will explain that, why that is the case. When you look below the budget by work category, you can see the development enhancements and PMO are nearly equal. These efforts attract 90% federal participation and 10% state funding, which is basically 88% of the 90% of the funding participation. I think our CFO can explain better than that. As you can see, system operations, security, and maintenance support, we have a slight increase there. That's due to some additional work that we are doing on PHE unwinding, as well as some initiatives around security. And last year, we had nearly $1.1 million for the CMS, implementing CMS corrective action plan that CMS requested MDH, MHBE, and DHS to implement, which we successfully implement within the budget. And so that project is completed. However, you can see the PHE unwinding initiatives, we have FY23 and FY24 equal amount, which we are currently working on. And the state budget increase of $750K is, as you can directly associate with the SHOP implementation effort, which is 100% state participation. So we've been given that funding starting FY24. Our goal is to implement a robust end-to-end platform for the SHOP by FY25. So we will be requiring one more round of funding from the state in FY25 as for this effort. So I'll stop here and ask for questions.
I just want to discuss a brief moment of the procurement process that we did. The procurement officer issued the request for RFR to the master vendors. I made every committee member sign a evaluation consent form stating that they would have integrity and reviewing all resumes if they came across any master vendor, any resume that they were familiar with, and they felt that they could not be non-biased, they would bring it to my attention. I had no concerns or complaints from any of the evaluation committee members. The procurement officer sent out valid technical proposals to all the evaluation committee members. I had access, and only me, to all these files, okay? Once I released the technical proposal, the committee members who were assigned to that particular functional area, they did a short list because some of the RFRs yield 80 candidates, some yield 90 candidates. And so they started off by process of elimination. And then once they had a good pool of resumes that they could further interview, they did that. And then they would come back to me and ask for the financials. And only I had those financials. So even though we paid more weight, we gave more weight, I should say, to the technical aspects of resumes, I released the financials. So if they sent me a list of 8 candidates, they only got to see the 8 financials for those candidates, no other ones, okay? After they reviewed and I shared the financials with the committee, would send me an email and they would rank the candidates by technical and financials, and then they would send the list back to me stating that this is who they wanted to award, and then I would review those selected ones to make sure that they did have a master contract with someone and that the rankings and the dollar amounts were valid for the state. Next slide.
Sure. Before you move on to the next slide, can you just explain to the board the evaluation committee makeup, how many people? And...
Yes, the evaluation committee were 3. If you want an odd number, just in case we get a tie. And most of the committee members were selected based on the functional area that they were stronger in. Now, maybe one person was really informed on that functional area, and the other 2 maybe not so much, but they all had IT experience. And it varied. Not all 3 committee members were for all RFRs. So we rotated all of them out, and they all did sign the consent form. Based on the functional area and the strength that they possessed in that area, we let them review the technical aspects of the resumes.
And when you use candidate up there, you're talking about the master vendor candidates?
Yes, we call them resources, so to speak. Next slide. This is just a snapshot of the process. So I released all these RFRs have already gone out to the in the community, and we started out with 101, 104. We currently have 115 resources that we have selected for award, and we have 40 more to go. A lot of long nights, weekends, and holidays during this process, but it was perfect. It was great. Next slide. MHBE requests the board to approve a total not to exceed amount of $33,969,420 with the federal finance participation amount of $24,376,578 and the state participation amount of $9,592,842 for the IDIQ contracts for fiscal year 24, subject to the availability of federal funds and state funds. Approve the task force issues under the IDIQ contract as submitted.
I move to approve a total not to exceed amount of $33,969,420 with the federal financial participation amount of $24,376,578 and a state participation amount of $9,592,842 for the IT IDIQ contracts for the fiscal year 2024, subject to the availability of federal and state funds, and to approve the task orders issued under the IT IDIQ contracts as presented.
Okay.
I have a motion. Second. Is there any discussion?
May I? This is Asia.
Go ahead.
Of the 110 vendors or the master vendors that we have selected, do you know how many of these are from the past?
I don't have a number. I don't have a number of how many were incumbents and how many were new.
Okay. Second question, the 115 resources that we have, and we are looking for 40 more for continuity purposes. 115 will continue to be part of the project that are involved in now. Do we know that?
I'm sorry, I couldn't quite understand. You broke up a little bit.
Sure. The 115 resources that we have now, because the vendors are changing and some of the resources come from one vendor or the other, how many of those 115 resources will continue working at the exchange, because that's good for us from continuity purposes?
Are you saying out of the 115 resources, how many of those are incumbents?
Right.
That's what it's, I don't know that number offhand, but I can tell you that everyone who applied for one of those RFRs, one of the functional areas, everyone had to interview. I sat in on a lot of the interviews on weekends and Sundays and evenings, just to review the process and make sure that everyone was getting an interview and just to watch the process basically. But I don't have a number of how many are incumbents because I'm new to the agency. So, and I don't know everyone by name. And we do telework, so it's hard for me to see everyone and to capture faces with names.
Okay.
So if I may add, just to your point, Mr. Singh, there are some functional areas. It was not exactly same as we did last time because of newer technologies. In fact, every single RFR was kind of refurbished, meaning we had to include the newer technologies. So the attrition was very low, probably less than 2% or something like that. But we did hire some new talents as well. Again, it's not a lot. From the continuity perspective, we are very confident. I think one of the questions that Mary Jean addressed last time, we are very confident that we retained key resources and we aligned the RFRs in such a way that certain key resources would have to be assured. And also the schedule conflict, like Cheryl pointed out, it was a new requirement for the IT organization also to have 3-member panels who are basically 3 IT directors, to have them in the panels, probably around 500 interviews, 400 interviews. So it was a logistical nightmare for me personally, but while continuing with the day-to-day operations, but we are managing to do that. So specifically to your question, we would hope to retain the best talents, and there are always opportunity to hire some good talents as well. We are mindful of that as well. The attrition-wise, it's a very low percentage, but once we are done with our entire process, maybe when we come to the board for the remaining numbers, we should be able to give you an accurate number at that time.
Next question I have was, with the current situation in the IT, at least from the newspaper articles, all the major companies, whether it's Microsoft, Google, Amazon, is laying off IT resources that they had employed in the last 3-4 years because everyone probably overdid it. Did we see any benefit of or any surplus of the IT resources in our pricing negotiations? Did that impact at all?
That's a great question. We were mindful last several years not to overexpand. So it was a very tricky situation to balance between. We were given a lot of budget at that time from federal agencies, federal government, if we wanted to do that, but we were very careful in taking up what we can do and didn't hire resources with huge slack for attrition. That's number one from the past perspective. But currently, the issue for us is we are hiring people in April and asking them to start in July. In this marketplace, that is nearly impossible to retain new resources in few months' time. So that's one of the reasons we are very cautious in that also. In fact, some of the security positions, some of the newer positions, like what we are going to hire by the end of this month or early next month, we are trying to push it as much as we could closer to July so that we could hire some talent as opposed to hiring somebody and then facing the situation of replacing that person through substitution by the time it comes to July. So it's a balancing act, but we are trying our best there.
Thank you. Two more questions, if I may. During the recent investigation of the allegation of IDIQ irregularities, contracting irregularities, one of the allegations I think we saw that was some of the vendors we had are some of the individuals who had financial interest in many of these corporations had multiple contracts with the exchange. So during this contracting process, did we eliminate any duplicate financial interest, overlapping financial interest, so that we are dealing with only one vendor and one individual having three different companies and three different vendors?
No, what we did was pick the best of the best, regardless of what agency they were affiliated with, or if they were incumbent or if they were new. We selected the one who offered us the best technical resume.
So we may still have a John Doe owning two different companies and both companies have contracts with the exchange?
So Singh, I can address this because what Singh's asking. When we looked at the IDIQ contracting process, there was a recommendation that we came out with, which was to require that any vendor that we give at least $200,000 to provide them with that amount of money, that they have to file with the Secretary of State a list of the names and addresses of the resident agents of the businesses. So we can't do that until after we enter into the contract of who we know we're paying. Now that these RFRs those contracts are being executed, the next step is we are going to require from all of these vendors that they submit to us what they've submitted to the Secretary of State. As best we know, there's no other state agency that's requiring this or requiring documentation of it, but we're going to go that extra step and require it of all our vendors. So we can't do that until after we execute the contracts.
So we may end up in situations still where we ask for a resource, two vendors give us a resource as if they're competing with each other, but they both are owned by the same individual.
No, when we had a master contract submit a resource, if we saw duplicates, we asked them to submit a letter of commitment, and whichever one of the master contractors got me the letter of commitment first, then the other resource was disqualified, and luckily enough, no other resource would apply for that position. So we only had one resource per master contractor for a particular functional area, if I'm understanding your question correctly.
No, I'm not. Let's say we have a corporation, ABC, and the second is CBS, and they both are owned by a John Doe. So ABC submits a resource in request. And CBS also submits another resource person in response to our request. But we have one individual through different submitting two different resources, and then they are trying to compete with what others may submit too. So that was one of the allegations, and I think our discussion was that one was the $200,000 that they will have to report, but the other one was also that to the extent we are aware that an individual has financial in two different corporations, we will not allow both of it a response to the request.
Yeah, well, I believe that what the procurement officer said is that when we have two sources that are submitted by two separate corporations, whether they are owned by the same group or different groups, the requirement is that one of them submits their information to us, and at that point, all others are dropped. So when we come to making the final choice among a listing, we only have one corporate source for each corporate contract.
Correct.
And then we've eliminated the problem that you've identified.
Okay. And I would like to add that once, I went through SSTAT and I pulled everyone's standing in SSTAT. And I didn't see any duplicate accounts because that would have been a red flag. Now, if you're asking if one person had multiple contracts under different names, I can't track that. If they open up two different businesses, two different filings with SSTAT, I can't say it was the same person who did that. They all came up as individual contractors with different addresses, federal ID numbers. So, and that's what we went by.
Okay. And the last question I have is, we know we did our internal investigation, but we also, OAG's office was doing their investigation. Did we ever hear back from the status of their investigation?
I'm not familiar with the investigation with the AG's office, I'm sorry.
There has been nothing received to date.
Okay, thank you.
You're welcome.
Ben, did you have a question?
So I just thank you for all the information. You mentioned 155 people. Is that full-time or is it just a body count? I was curious about how many people there actually are going to be employed through this IDIQ.
Yeah, approximately 155 through IDIQ consulting, and then 13 are the full-time state staff that constitute for us at this time.
So 155 includes both the IDIQ and the state staff.
Oh, I'm sorry, 155 is only the IDIQ consultants. And we did the last couple of years tried in multiple ways to reach out to DBM and requested more state wins and also state contract positions. Unfortunately, we never received. So at this time, we have to continue with this model to operate the exchange.
Thanks. So we left off with a second. All in favor?
Aye.
Any opposed? Okay, motion carries.
Thank you.
Last, we'll hear from Debbie Rupert, Executive Director of Office of Eligibility Services at MDH, to hear about the Medicaid Public Health Emergency Unwinding update.
Hi, Secretary Laura Herrera. Good to see you.
Good to see you, Debbie.
Chair members and members, thanks for allowing me. I know that we're limited in time. I did submit this presentation, which I believe that did come out in your board package. And for the sensitivity of time, I'll some things in the presentation. You know, as legislation was being made, I know that Cynthia's bringing that up.
Can't see it?
No, we can't see it yet.
As legislation was changing, linking the unwinding with the PHE, we felt that it was essential to get communication out to our many, many partners, which we did. We were overwhelmingly reached out by all of our community partners, which is very exciting, asking what they could do to assist in the unwinding. So we thought the key is in education. And so this presentation, we've probably presented to more than 100 groups, DDA, providers, dental providers, all throughout the U.S., the state, asking them to assist us in the unwinding redetermination outreach effort. If you go to the next page, Cynthia. So just a little overview. We did a Medicaid check-in campaign. We were very thoughtful, as you know, in our strategic plan to continue renewals through the entire pandemic. And we were one of the few states that did that, which allowed us to stay in contact with the largest portion of our recipients. As you know, we do approximately a 58% auto renewal each month. So between our auto renewals during the pandemic and our outreach effort, we had been able to reach the majority of our clients. During the pandemic, our enrollment grew greatly, as you probably heard, from 1.4 to 1.7 individuals. And in April, we started a campaign. You may know this communication firm GKV, who did the Go Vax campaign. And so we polled our recipients and tried to obtain what was important for them, what they needed to know. And the most important factor is for us to be able to be in touch with them so that they can get their renewals. One of the things that we stress to many of our partners is our renewals are broke out over 12 months. CMS is not requiring us to do this in a shorter period of time. However, some states have elected to do the renewals in 6 months. We, again, are being very strategic because whatever month the renewal is in will be the month that the renewal will be due in the following month, and not to shift enrollment, not to condense all of our renewals into 6 months. We have elected to do this over a 12-month period. We started sending out, as we have been sending out renewals every month, but as part of our 12-month unwinding, we started sending renewals out in April for our May redebts. Our first enrollees may be terminated on May 31st if they come back and complete a renewal and no longer found eligible, or in fact, if they don't complete the renewal, they will be terminated. Our Medicaid check-in, the campaign that they've been doing is to encourage individuals to come back and update their address. We don't want them to do a new application. We stressed upon all of our many partners, do not encourage them to come back to do the renewal, just to make sure that their address is up to date. Our many key partners through this outreach effort has been our managed care organizations, our Maryland Health Benefit Exchange, our Department of Social Services, and CRIS. And one of the things that we found out is that having our providers know when the renewal is essential so that they could help in the effort. Cynthia, next page. This is just a zoomed in timeline showing that our first renewal started in April, will go through May. Next slide. And this is just in a different timeline, again, showing that it will continue through the next 12 months. Next slide. Our redeterminations, we've made this data, we've updated our eligibility verification system, which is the system where our providers check someone's eligibility so that they'll be able to know when someone's renewal comes up. Our hope is that when they present to their office for care, it's a requirement that we ask all providers to check for Medicaid eligibility. That way they can make sure that they're following the right referral process, which MCO and et cetera. And so they're able to hear when that renewal is up. So our hope is that through our education to our providers is if they hear that their month is in May, that they do that extra reminder to remind them. Our partners, and we are also making this data available through our CRIS data. It's currently being processed. We're currently in a beta test with FQHCs, and at the end of May, we'll offer to other FQHCs, and then in June expands to all the CRIS participants. Next slide. In our redeterminations, we're doing targeted outreach to allow individuals that if they miss their renewal, one of the things we're very sensitive is that we don't want that gap in coverage. So if someone doesn't do their renewal and comes back within 120 days, they'll be given the opportunity just by coming back for their benefits to be considered for the last 120 days. Previously, CMS has been very restricted that once an individual is disenrolled from an MCO, the MCOs have not been able to do outreach. CMS changed that guidance, which allows the MCOs to continue to do outreach for 120 days. So we aligned the reconsideration period because it's in all of our best interest for continuity of care to make sure that that individual stays in that MCO. And so we've done a lot of system modifications and education, allowing them to continue to do outreach. And so, as I mentioned, they'll go back to the MCO. And then if for some reason they don't do their renewal, and it's after 120 days, then they would go into a fee-for-service coverage for a period of 10 days, and then they would get reassigned to either their old MCO, if that's their selection, or make a selection for another provider.
Can I ask a quick question?
Yes.
Well, how are you addressing people who are homeless or transient in terms of addresses? Because many of them are not going to have a fixed address.
Yeah.
Maybe it's a shelter, maybe it's under a bridge, and they're throughout the state, not just in the city.
Yeah, so several years ago, we started an outreach effort in regards to our homeless, and we were, I think, very strategic in trying to find places that the homeless individuals seek assistance, and it is at our local health departments. And so if anybody does an application and attests to that they are homeless, their mail and communication goes to their local health department. So they have a point of entry that they can go to seek assistance. And so that's one of the many, I recently shared that with CMS, and they were so pleased, and they had not heard that initiative where a homeless person could default to a local health department so that they have a safe haven to pick up their cards, their communication. So that is one of the ways. As you know, we are working with the Maryland Health Connection to implement the easy enrollment. We've started our design session, and what this will allow is someone who is no longer eligible for Medicaid to easily be self-enrolled into a qualified health plan. And CMS, in our discussion with them and for approval, they were very sensitive and very supportive of us having the 120-day reconsideration period so that someone could still re-enter into Medicaid if something had changed within that 120 days of when the renewal was due. Next slide, Cynthia. So this is our Medicaid campaign. You may have seen some of the ads. It started in March 23 for our pre-launch. We've encouraged participants to update their information. The campaign is in English and Spanish and statewide distributions. Next page. So the campaign is going to launch for 12 months. We are currently evaluating with every campaign. You want to make sure that it's being successful. So MHC is running some data for us, and we'll continue to evaluate to make sure that people aren't coming in to do redebts too early, that they're only updating their information. And we'll analyze this and work with the campaign firm to see whether or not we need to do any strategic changes. We're doing social media, digital media, TV, radio, outdoor and home boards, a very broad population we're reaching out to through this campaign. Next page. We coordinated with DHS for our fee-for-service partners. As I mentioned, when someone comes back to Medicaid, if they lost coverage for 10 days, they're in fee-for-service, and our non-MHBE recipients, which is our age, blind, and disabled population, are not placed in the MCO. As with Maryland Health Connection, DHS has resumed their redeterminations. They've hired additional staff. They're working with us in co-branding on the marketing material. And we have very great partnership meetings and making sure that we're prepared from a global united front. I can share with you, we increased our local health department grant funds for my eligibility grants, providing them additional funds for extended hours, additional community outreach efforts. And so we feel very confident and ready to meet the challenge of the renewals. I can share with you, I met with MHBE team this week, and we talked about that the auto renewal rate for the month of May renewals was 48%. As I mentioned earlier, we're averaging about 58%. But we knew that a rate was going to decrease because there's a larger number of individuals that we know aren't eligible that we've been carrying during the pandemic. All the mailings have gone out, so they should be hit in the streets. We've communicated with all of our LHDs or DHS. So everybody has boots on the street, and we're ready to assist the population as they get their mail and come in for assistance. And as you know, there's many modes of which someone can seek assistance, whether it's calling the call center, using the telephone app, presenting at a local health department or a DHS office. Next slide, Cynthia. MD Think has an online portal for our waiver participants to use. We have presented to almost all of our waiver partners, DDA, the special waivers, teaching them how an applicant can use their MD Think to go on to see when their renewals. We have a how-to guide for someone who may not know how to use MD Think in this presentation. And on our web pages. Next page, Cynthia. And so how can you help? We have created provider toolkits, which we have shared with all of our providers. We posted the e-check-in flyer and shared that so that they could post in their clinic, just so that everybody does see that there's a way to make sure that we stay in contact. And next page. This is a list of additional resources and links that we put together for our providers and our community partners to link the information. Again, ensuring that everybody knows that it's time. Oh, Easter Sunday, I have a nephew that is in the autism waiver. And my sister said, did you know that redebts are due again? I need to make sure to get them. And I said, I have heard that, you know, so it was that even to my family, that word has gotten out and people are aware, you know, that they need to renew and how important it is to maintain their coverage. And I think that's the last slide, Cynthia. I know that I rushed through this, and if anybody has any questions about this, I'm readily available and willing to assist in any way I can. And thank you all for your continued partnership and sharing this information with the providers and partners that you have. And I'm open to answer any questions that you might have about renewals.
Thank you so much, Debbie. Any questions? Thank you, Debbie.
Good seeing you.
Good seeing you. And that brings us to the end of our meeting today. With that, I will close today's meeting. Thank you all. Oh, motion to close.
Second.
Second.
Anything else? Okay.
Favor.
All in favor. Thank you, everyone. Have a nice evening.
Thank you.
Betsy.